I work at PHO Laboratories as a medical microbiologist. I'm predominantly involved in the areas of virus detection. In the virus detection laboratories, we detect viruses that cause infections such as respiratory infections or gastroenteritis or meningitis. I also am involved in the respiratory bacteriology laboratory where we detect infections such as Legionella infections or Mycoplasma. My other area that I'm involved in is the arbovirus laboratory where we detect infections such as West Nile virus, dengue virus. What excites me about my research is that we get to take specimens that have arrived at the laboratory and investigate them for novel findings. One example of this would be back in 2010 when we decided to have a closer look at the genetic makeup of a virus that we have in our laboratory called RSV. What we found was that we discovered a new genotype and we named it ON1 for Ontario. Subsequently, there's been around 60 publications globally of others reporting the same virus. So that's been quite exciting that we were actually the first to pick up a new genotype that had emerged. I hope that the research we're doing will help have impact for other laboratories that are also doing similar testing and also to hospital laboratories. We aim to help find new information that will help guide future testing algorithms and also disseminate new information about viruses that already exist. I chose to do my research at PHO Laboratories because I currently work there as a medical microbiologist. Working at PHO Laboratories gives us access to a large bank of clinical samples, both for routine pathogens and also emerging pathogens. Using those samples, we're able to find interesting things and then disseminate that information to stakeholders. So when I was growing up, my first memory of thinking about what I wanted to do as an adult was as a child around 5 years of age at the airport in Sydney, Australia, looking up to the sky and seeing the planes going overhead. And I decided that I wanted to be a pilot. But I don't know where that slowly dissipated, and then by a few years later I had decided that I really thought it would be great to become a doctor. The things that interested me were, at that age, was more the ability to help people, and it also seemed really interesting. And then as I got older, when thinking about what it would be like to have a profession, I thought one big plus was the ability to have intellectual stimulation while doing a job was also really great.